With a team of physicians, nurses, midwives, and physical therapists, UNM Sandoval Regional Medical Center is committed to provide the best care for women. And joining me now is Dr. Jenna Donovan, the Assistant Professor of Female Pelvic Medicine and Reconstructive Surgery. Thanks so much for coming in. So in today's health check, first off, what is a urogynecologist and what kind of, what do they treat?
So a urogynecologist is a physician that traditionally trained as either obstetrics and gynecology or urology, and then went on to do fellowship and special training in female pelvic medicine and reconstructive surgery. And the conditions that we treat are pelvic floor disorders. Pelvic floor disorders are things that are traditionally hard for women to talk about, and they can be conditions like urinary incontinence, fecal incontinence, and pelvic organ prolapse.
Now, how common are these sort of symptoms and conditions?
So they're a lot more common than people realize, and I think it's because a lot of women are very embarrassed to talk about this. They think they're the only person that has it. Urinary incontinence is very common, about 15%.
Oh, wow.
Fecal incontinence is also about 10% of women, and pelvic organ prolapse is around 5%. So about a quarter of all women will have some type of pelvic floor disorder.
Okay, now let's start off with urinary incontinence. There's different kinds, right? So what are the different kinds, and of course, what are the different options that women have?
Right, so there's two main types of leaking urine. We call stress urinary incontinence the type of leaking when you do activities, so laughing, coughing, sneezing, exercising. Women will come in saying that they were jumping on a trampoline with their children and then they were having leaking of urine. The other most common one is a condition called overactive bladder, and it's just like what it sounds like. Your bladder's overactive, so you might go to the bathroom very frequently during the day or night, have a lot of urgency to try to get to the restroom, and sometimes not be able to hold it and have an accident with no warning.
Okay, and then what are the women's options?
So there's a lot of options that involve not just surgery. Sometimes women are worried, they think, oh, it's just gonna be surgery, and that's not the case at all. So for the leaking with activity, you can do those exercises, which are called Kegel muscles, you know, squeezing those on your own or with physical therapists. There's devices that are soft plastic devices that can go in the vagina that help support the bladder. That's something that's not surgical as well, and then there is surgery.
So there really are a ton of options for women. So the next thing we'll talk about, pelvic organ prolapse. What is this? What are the symptoms? And then of course options again.
Okay, so pelvic organ prolapse, pelvic organs are things like the bladder, the rectum, the intestines, the vagina. And those are supported by muscles and connective tissue in the pelvis. And when those areas are weakened or damaged, those organs can kind of fall out. And so women might feel pressure or heaviness. They might notice or even see a bulge. Sometimes women that will have trouble going to the bathroom and might have to push things back inside in order to go to the restroom. With that. The treatment options, so again, are the same. So you can do exercises, there's physical therapy, there's the pessary devices, which again are non-surgical, and then there's many surgical options as well.
Okay, and then the last one we'll talk about here, accidental bowel leakage. Tell us, what are the options for women for this?
Right, so accidental bowel leakage is a term that we think most women prefer because again, it's so hard to talk about, but that's when you have trouble controlling your bowel movements and might have accidents. And again, many treatment options that include exercises, lifestyle changes, changing your diet, and even surgery. But I think that the take-home message that I'd like people to hear is that these conditions are much more common than a lot of women realize. They think they're the only person, or they think that this is just because they're aging, or they're too embarrassed to talk about it, and they think that either there's nothing that can be done, or that they're not effective, or that they'd only have to have surgery. And really, the truth is that it's common. Many women have it. There are a lot of treatment options available, and they should feel comfortable to come and talk to their doctors about it.
Okay, so if somebody is kind of having some of these symptoms, how do they get a hold of you all? How do they come see you guys?
So at UNM and at Sandoval Regional Medical Center, we have a division of urogynecology, and so you can just call the hospitals and get an appointment with us.
All right, well thank you so much for coming in. And if you guys if you guys want a recap of what we just talked about here, just head over to CASA.com and we'll have the information to UNM Sandoval Regional Medical Center on there.